Hello, welcome back to the Chronicles of an African Diaspora Nurse. Thank you so much for tuning in again. Today, I'm bringing you yet another story from the diaspora, and this time is all the way from Australia. Our guest today is someone that I first came into contact with in 2013. He is none other than the host of the upcoming conference, which is happening live in Ho in Ghana. As you know, World Mental Health Day falls on October 10th. So all over the world, there are programs, focusing on mental health, and Ghana is no different from the other places. So let's welcome Francis.
Thank you.
Can you tell us a bit about yourself and what you do in Australia and why you are in Ghana?
I'm a mental health nurse. I've been working for the last nearly 40 years. I trained in England, and Margaret Thatcher drove me to Australia some 36 years ago. And I've remained a mental health nurse. I run my own practice in Australia called Positive Wellness Recovery Centre. And the last 10 years, I've been involved in mental health in Ghana, starting with Mental Health Foundation of Ghana, and it's now called Mental Health and Wellbeing Foundation. And we've been running conferences in Ghana since 2013. And this year we are about to celebrate our 10th anniversary.
You and your team, you've done a lot in terms of contributing to mental health care delivery in Ghana. But I'm looking back at the first time I came into contact with you, that was exactly 10 years ago, at the first ever mental health conference in Ghana. And we had the opportunity to present a poster, and that's how I came into contact with you via email before we even met in Accra. So it's been 10 years, and we all know that, 10 years ago, or probably further down the years, I remember in 2006, we had only 2 psychiatrists. Looking back at the developments so far, what would you say the impact has been? And possibly you can tell us why you even had the thought of going back to give back to mental health in Ghana. Tell us a bit about that, and then you can tell us about, the progress so far. What inspired you to give back?
Yeah. Well, in 2012, a friend actually living in the UK sent me an email of the human rights report that was talking about the conditions of mental health. The clients, patients were in Ghana who were going to prayer camps and being chained to trees. But even the mental health hospitals were none the better, because there were only 3 psychiatric hospitals in the country, and they were all located in the south. Mm-hmm. So woe unto you if you are somewhere, even not far, let me say even halfway through Ghana, in Kumasi, therefore, can you imagine if you are somewhere in the north, in Tamale or Bogatanga, and you experience mental health issues? So we came together and basically said we needed to do something about it. We thought that if we were to bring some experience from diaspora, we could then help those on the ground to start changing. So that's how we came about with our first conference, which you attended. And so many people have come back to us, and actually that experience alone gave them the opportunity to go ahead and go for further studies. And in fact, we took people to Australia to study mental health and receive their PhDs in mental health.
Yeah, that's really impressive. But, implementing something like this on this scale involves a lot of collaboration and partnerships. And I'm aware that there are groups all over the world. Some people go, and I'm not aware of all the groups, but I know that there's a lot of input from different quarters, different countries abroad, involving the African diaspora and with other people from other countries as well. How easy is it to collaborate or to network and get all these people together to implement something?
As you may recall, the first conference, we actually had people from Norway and Kenya and Germany to attend. I've mentioned Canada and the UK as well. I brought in people, as many as 15 people from Australia for the first conference, and everybody paid their own way to come because they found something in it for them, the passion to help human beings. From the work that we've done, a number of people who attended the conference from day one or subsequent conferences have gone on to do other things. 10 years ago, I think you rightly said, when we were coming to Ghana, there were a handful of psychiatrists. In fact, I've just been looking at my statistics, and there was only one recognized clinical psychologist within the health services. Despite the fact that Ghana was training psychologists, most of them were going into industrial psychology. There was no occupational therapist, and there was not, I'm not even sure whether there are social workers now classified within the mental health services. But the influence was also to advocate for the changes. For example, it took many years to get the Mental Health Act to be passed through Parliament. The legislative instrument was also many years, more than 6 to 8 years before the legislative instrument was passed. During this time, we were advocating for all these changes to come, supporting the Chief Executive Officer, Dr. now Professor Acquah, retired, to make these changes. And part of the Mental Health Act was to decentralize the mental health services into the regional areas. And it was gratifying yesterday to visit one of the hospitals in Aflaho, the K2 South Municipality Hospital. And in fact, the first building, when you enter the hospital, is a mental health unit, and patients sitting there waiting for assessment and treatment. So through the advocacy work that we've done collectively, some of these changes are occurring. Some of the people who we have upskilled them through attending our conferences and acquiring skills such as mental health first aid training have now left the country to go to greener pastures, such as the UK.
I was discussing this with somebody, and you can't begrudge people, to travel and see greener pastures if, things are, hard. I want to talk about funding. We all know that the health budget allocated to mental health service in Ghana is very, very, very low. And so funding has always been an issue, providing patients with services, medication, for example. What's your take on that?
Yes, it's absolutely challenging, and it's absolutely difficult. And even for us ourselves to get funding to come in and run the conferences and support people, it's like us going around with the begging hat. And it's been very challenging. We have been fortunate that we were associated with one University of Newcastle, in Newcastle, in Australia, in New South Wales, and they had been our biggest funders and support. But even this year was very challenging for them to support us in their way. I have been fortunate to be a member of Rotary, and my Rotary clubs have supported us, and on these occasions, more individuals support than general support. But the Ghana system itself remains the biggest challenge. Sadly, one of the difficulties is that even when you have ideas and you want to collaborate with them, they are not ready for those things.
I think in Ghana, we are very good at theory. There's a lot of things that people go abroad and learn, but I don't know, this is my honest opinion, that is when you come back, it's the systems in place. For example, if you've gone and done a PhD, you've come, you've seen all these brilliant interventions, and you want to come and implement. Because that is not part of the local guidelines, the protocols of, let's say, if it's a ward, is the way they do things, is the way they've been doing it. And you come in to bring all these new, new ways. I think it's always a challenge. So we go and gather the knowledge, we have it, but then coming to implement it. So in spite of all these, I mean, you still got the zeal, you still got the passion, you're not giving up. So the upcoming conference, what should the attendees expect? The people who are attending, I suppose there will be doctors, psychiatrists, nurses, psychologists, social workers, patients or service users.
We've got a variety of presentations. We've got some research presentations, and we've also got practical presentation from other people. As I said, one of my colleagues is coming from the US, which looks at Wellness Recovery Action Plan. And that's a very practical thing that people can develop their own RAP. And when you have developed your own RAP, then you can actually use it to pass it on to other people as well. So those are some of the practical ones. We've got a presentation coming from Nigeria, which looks at the violence extremisms that causes post-traumatic stress disorder. How do you manage those sort of things? Although practically don't see that a lot in Ghana, but still there are things that really you learn from. Other presentations that will have some of the effects of the changes in the Mental Health Act that has become much more practical as well. So there will be a variety of topics for people to experience, including first-time presenters. And in fact, there are a whole lot of prison officers coming, especially having seen the difference that the program has made. And a doctor working in the prison system who has actually transformed the prison community. It's very impressive. And I think we will have about, locally, even about 10 prison officers coming to listen to their presentation.
What do you see for the future of mental health service delivery in Ghana? What do you foresee?
Ghana is in the throne of elections, and sadly, mental health remains the bottom of the ladder. But for those of us who are coming in and advocating and doing even our little bits, are making the difference. So we tend to start to see that there are a number of individuals coming in doing things, like the people from the UK come in and support. I think they've got the mental health from
mental health educators.
Yes. There is another group coming from the US, And they are in the process of, they built a clubhouse, which is a rehabilitation center. There are a lot of other educational services that our people are using. So the early intervention is better than cure. So people are running programs of different awareness programs, suicide prevention programs in schools, online, etc. And collectively, if everybody is doing their little bit, then overall we can make a difference because we can't rely on the government to make that leap.
Yeah, thank you so much. So from what you're saying, I can gather that it's the citizens and well-wishers, people who have the passion, who love to see an advancement of mental health services delivery. We need to rally together and we need to be persistent. And I think over the years, this is what has made the small changes. I always say that we are not where we were years ago, and we are not where we want to be, but we are moving. We are not standing still. There are things happening. So what will be your advice to any African diaspora living in the diaspora, wherever they are, Australia, UK, Canada, US, Germany, all over the place? What would you say to them in terms of giving back?
I would just say, Pessoa by Pessoa builds a house. If all of us come in with our Pessoa to contribute, however we do it, we can make a difference in the mental health world. One of my colleagues from Canada, Professor Vincent Ajapon, has been instrumental in doing a debate with the medical students. And from what we started our conversation around the number of psychiatrists in Ghana, maybe 13, 14 years ago, today there are over 60 or approximately 60 psychiatrists in Ghana. We know that we can make a little bit of a difference. So thank you for this opportunity. And if you are hearing it before the conference, you're welcome to come in to Ho and join us at the conference.
Thank you for all your hard work, and I wish you well in the successful implementation of the conference. And we will hopefully meet again somewhere next year or whatever the time permits. Thank you so much.